Hello everyone. Today, we're diving into the world of a medication called hydrocortisone, commonly known by its brand names such as Cortef and Solu-Cortef. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Hydrocortisone, known by brand names such as Cortef and Solu-Cortef, is a corticosteroid used to treat various conditions by reducing inflammation and suppressing the immune system. It's often prescribed for conditions like adrenal insufficiency, severe allergies, skin diseases, asthma, arthritis, and certain autoimmune disorders. Hydrocortisone can be administered orally, topically, or through injections, depending on the condition being treated. Warnings: Hydrocortisone comes with its set of precautions. Long-term use can lead to side effects such as osteoporosis, cataracts, and increased susceptibility to infections. It's crucial for those taking this medication to be monitored regularly by their healthcare provider. It should not be stopped abruptly without medical advice, as this can lead to adrenal insufficiency. Patients with systemic fungal infections should not use hydrocortisone. It should be used cautiously in individuals with liver disease, hypothyroidism, and gastrointestinal diseases. Before taking this medicine. Before starting hydrocortisone, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug. Patients with a history of tuberculosis, infections, diabetes, high blood pressure, mental health disorders, or any form of infection should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Regular monitoring is advised for those on prolonged therapy to check for side effects and adjust dosages accordingly. Side effects: all medications can have side effects, and hydrocortisone is no exception. Some individuals might experience increased appetite, weight gain, mood swings, and trouble sleeping. Long-term use can result in more serious side effects such as high blood pressure, diabetes, thinning skin, muscle weakness, and increased risk of infections. It can also cause adrenal suppression, leading to fatigue, weakness, and dizziness, especially during stress or after stopping the medication suddenly. If you experience any unusual symptoms or severe side effects, consult your doctor immediately. Interactions: hydrocortisone might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Common interactions include certain vaccines, anticoagulants, and drugs that affect liver enzymes. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking hydrocortisone. The dosage and form depend on the specific condition being treated. For oral administration, the typical dose for adrenal insufficiency ranges from 20 to 30 mg daily, divided into multiple doses. For other conditions, the dose varies widely and must be tailored to the individual patient. It's important not to alter your dosage without consulting your healthcare provider. For topical use, the application frequency and amount will be directed by your physician. Avoid: while on hydrocortisone, it's advisable to avoid exposure to infections, as the drug suppresses your immune system. Avoid abrupt discontinuation of the medication without medical guidance. It's also recommended to limit alcohol intake and avoid live vaccines during treatment. Always follow your healthcare provider's instructions on diet, particularly regarding salt intake if you're prone to high blood pressure or fluid retention. FAQ: many wonder about the age restrictions for hydrocortisone. This medication can be used in both adults and children, but dosages and administration routes may differ. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing: that wraps up our overview of hydrocortisone. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.